Bismillahirrahmanirrahim. Now we are continuing with the question number 9, that is, a 40-year-old man suffers blunt trauma to the lower chest. Imaging shows herniation of the abdominal contents into the thoracic cavity. Which part of the diaphragm is most likely ruptured? Name the embryological origin of this part. The costal or the muscular part of the diaphragm is ruptured. Embryological origin, it develops from the pleuroperitoneal membrane. Muscular part derives from the myoblast migrating from the septum versum and the body wall. Question number 10 is, a newborn presents with the respiratory distress. Imaging shows a defect in the posterolateral part of the diaphragm with abdominal organs in the left thorax, which embryological structure failed to develop properly. Explain the normal development of the involved structure. Answer is pleuroperitoneal membrane. Normal development is pleuroperitoneal membrane grows medially from the body wall. It fuses with the septum transversum and dorsal mesentery of the esophagus. It separates the pleural and peritoneal cavities. Failure leads to Bogdelic hernia. Question number 11 is, a 35-year-old man presents with difficulty breathing and abdominal trauma. Surgical exploration reveals a tear in the central tendon of the diaphragm. What is the central tendon of the diaphragm composed of? Describe its functional significance. It is a fibrous connective tissue, non-muscular. Functional significance, it serves as the aponeurotic insertion for the diaphragmatic muscle fibers. Contributes provides structural support for contraction. Contributes to the dome shape of the diaphragm for effective lung expansion. Question number 12 is, a 6-year-old boy presents with recurrent respiratory infection. Imaging shows partial paralysis of the left hemidiaphragm. Which nerve is most likely injured? Explain the consequences of the injury to this nerve. Left phrenic nerve is injured. Consequences will be ipsilateral diaphragmatic paralysis, reduced lung expansion, dyspnea on the exertion, elevated hemidiaphragm on imaging, compensatory overuse of accessory muscles for respiration. Sometimes in the viva, accessory muscles of inspiration are asked. Question number 13. A full-term newborn presents with respiratory distress shortly after birth. Chest imaging shows poorly expanded alveoli. Histology shows immature alveolar sacs and insufficient surfactant. During which developmental stage did the surfactant producing cells develop? Explain the significance of surfactant in neonatal aspiration. This is the terminal secular stage. Surfactant is secreted by type 2 pneumocytes, which is usually asked in the viva, OSPE, and BCQ as well, which reduces the surface tension in the alveoli, prevents alveolar collapse and facilitates efficient gas exchange at birth. Question number 14. A 24-week-old fetus is evaluated in utero. Imaging shows primitive bronchi with terminal sacs forming capillaries approaching alveolar sacs. Identify the stage of lung development. Describe the major histological and functional feature of this stage. Answer is, canalicular stage features are formation of respiratory bronchioles and terminal sacs, differentiation of type 1 and type 2 pneumocytes. Vascularization increases, allows potential gaseous exchange. Surfactant production begins late in this stage. Question number 15. A 5-year-old embryo shows outpouching from the ventral wall of the foregut that will later form from the lower respiratory tract. Name this structure. This is laryngotracheal diverticulum. What is the normal development of this structure? Diverticulum includes caudally. Tracheoesophageal folds fuse, separate esophagus posteriorly and laryngotracheal tube anteriorly. Branches from the bronchial buds, primary bronchi are formed. Question number 16. A 16-year-old fetus shows extensive branching of the bronchi with endodermal lining and surrounding mesenchyme, but alveoli are not yet found. Which stage is this? When alveoli are not found, which stage is this? Pseudoglandular stage. The key events of this stage are formation of bronchi, bronchioles, and terminal bronchioles. Epithelium resembles exocrine glands. No gaseous exchange. Vascularization limited. Question number 17. A newborn at 30 weeks gestation is examined for respiratory function. Histology shows terminal sac with the thin walls and capillaries closely associated with alveolar epithelium. Name the developmental stage. Explain the importance of this stage in this fetal survival. Terminal sac secular stage. Importance is formation of thin-walled alveolar sacs for potential gaseous exchange. Type 1 pneumocytes form the barrier for gas diffusion. Type 2 pneumocytes produce surfactant critical for prevent preterm survival. Question number 18 is, a 33-year-old embryo is studied. It shows formation of lung buds from the ventral foregut and surrounding slanting mesoderm. Name the embryonic stage of the respiratory system. Explain the contribution of endoderm and mesoderm in this stage. Embryonic stage is this stage is embryonic stage. So contributions from endoderm forms the epithelial lining of the larynx, trachea, bronchi, and alveoli, and splanchnic mesoderm forms the cartilage, connective tissue, and smooth muscles of the lungs. Question number 19 is a 15-year-old boy inhaled a peanut while eating and began coughing violently. He is brought to the emergency room. Imaging shows that the foreign body is lodged into the one of the primary bronchi. Which lung is most likely affected? Which lobe of that lung is most commonly involved? Explain the anatomical reason why the foreign body tends to lodge in this condition. Name the fissures present in that lung. The right main bronchus, the answer number one is right lung. It is present in the right upper lobe. Reason is the right main bronchus is wider, shorter, and more vertical than the left main bronchus. Aspirated foreign bodies preferentially enter the right lung due to its vertical orientation. Gravity, airflow during coughing further favor lodging in the right upper lobe bronchus. Fissures of the right lung are horizontal fissure that separates the upper and middle lobe, oblique fissure that separates the upper and middle lobe from the lower lobe. Okay, now sometimes the trachea scenario is given to you in which you have to identify that what is trachea, and the trachea histology questions are asked, and in which you have to draw the diagram from the Defoe atlas. Thank you.